Sadaf really set the scene very nicely, basically, reinforcing the fact that obesity is much more complex. It's just not as simple as sort of whilst the equation is simple, energy intake and energy expenditure, it's much more complex, and there are many, many factors that determine, our body weight. And a lot of these factors are driven by hormones, which Sadaf described very nicely. But of course, genetics plays a huge role. Up to 70% of our body weight is determined by genetics. And then there's also the role of medication. Now, we also have the interaction, of course, with the environment and the pleasurability, palatability of food. Now, going back to those hormones, I just wanted to set the scene because it's important in terms of pharmacotherapy and the development of pharmacotherapy. Sadaf has talked at length about leptin from adipose tissue. And of course, there are hormones from the gut, such as ghrelin, which is our hunger hormone, and also a variety of satiety hormones, including GLP-1, oxyntomodulin, and PYY, which drive appetite or satiety. And some of these hormones have been harnessed into sort of pharmacotherapy for obesity. Now, I'm going to quickly describe the body fat mass set point and what drives this before I sort of go on to the pharmacotherapy. But, we are supposed to have a set point, but this set point is sort of driven by abnormal lifestyles, by our environment, by stress, sleep deprivation, disrupted circadian rhythm. There's lots of different factors that over time push our set point over years of exposure. As mentioned, there are, interventions such as lifestyle modification that can help to redrive the set point back to where it's supposed to be. And of course, anti-obesity medication can drive that even further. And as Rob mentioned, bariatric surgery is probably the most powerful driver of the set point back to where it should be. Now, what's really important, as Rob mentioned, is that when we lose weight through a lifestyle intervention, one of the reasons as to why we regain weight is because our gut hormones move in the wrong direction. So we have a reduction in leptin because we have less adipose tissue. Our hunger hormone ghrelin increases, and our satiety hormones such as GLP-1 decrease. And the combination of this sort of biological changes basically drives, an increase in appetite. And even sort of a year after we finish our diet, our hormones haven't quite gone back to normal. And therefore, our body's always trying to regain that weight. Now, the properties of some of these hormones, the satiety hormones, such as GLP-1, have been harnessed into pharmacotherapy for obesity. And one of these medications is liraglutide. Liraglutide is a GLP-1 agonist. This is a daily injection of a GLP-1 hormone, essentially. And these are the results of the scale obesity trial, where patients were randomized to either a lifestyle or liraglutide 3 milligrams. This is the 1-year study. You can see much greater weight loss on the Saxenda arm. That's the trade name for liraglutide. And up to 3 years, we can see that on the medication, that weight loss difference versus placebo was maintained. But what's really interesting is as soon as we stop the medication at 3 years, weight begins to increase. And this is because, obesity is a chronic disease, and as soon as we stop, the medication weight goes back up. Now, there are now new obesity pharmacotherapies. One of these is semaglutide, which is a weekly GLP-1 agonist. And what we can see here is a much more powerful weight loss. This is 2-year data just being published, which is about 70% mean weight loss. This is the first time we've ever had an agent which achieves such a significant weight loss. And on the right-hand side, we have tirzepatide. This is a dual GIP-GLP-1 agonist. These are sort of, again, gut hormones, satiety hormones. And we can see here that at 3 different doses, the mean weight loss is as high as sort of 21%. So this will revolutionize our practice if we can get hold of these agents. And Rob has mentioned bariatric surgery. The great thing about bariatric surgery is that for those interventions such as a sleeve or a Roux-en-Y gastric bypass, the gut hormone changes go in the correct way. So we have low levels of ghrelin, the hunger hormone, high levels of PYY, GLP-1, the satiety hormones. So they're different to when we actually just lose weight through lifestyle interventions. And we have learned from these changes, what's important, I guess, what can drive weight loss and maintenance over time, as well as other changes such as changes in the gut microbiome, changes in bile acids, and lots of other mechanisms that contribute to that long-term weight loss. So as to the question, can we be whatever weight we want right now? Well, I think we all have a set point for weight, but this can be manipulated. Lifestyle interventions do not change the set point significantly, but obesity medication can, although not permanently, and bariatric surgery probably is the one intervention that can reset the set point, although many patients do put on weight over time, about a third of patients. So again, nothing is forever. And with that, I will stop and take questions. Thank you very much.